Hi, welcome to the introduction to the module for FCP1. My name's Charlotte Pedley. I'm just going to talk you through briefly through this screencast and just some of the main points that you might need to know in relation to the module. So the aim of the module is to talk us through the FCP roadmap document, which has been developed by HEE, and also allow us to be able to map ourselves directly across to the framework that's been provided, and also give us some indication as to how to develop our practice within an FCP role. The module learning outcomes will be to ensure that we're meeting the four below, and you'll be assessed on each of the learning outcomes through the two aspects of the assessment, which I'll come on to talk to in a little while. So the module learning outcomes are to develop the ability to apply and a personalised care approach with the advanced use of interpersonal and communication skills, making sure that we're using effective application of practical skills during assessment, diagnosis and management of individuals with musculoskeletal conditions, and also demonstrate an advanced level of critical understanding, critical reasoning and practical skills in assessment, investigation and diagnosis in complex MSK presentations. Now, module learning outcomes 1 and 2 will both be assessed during the OSCE, and module learning outcomes 3 and 4, so demonstrating comprehensive knowledge, critical evaluation of evidence-based client-centred management, prevention through multiple and interrelated interventions within collaborative MDT working with individuals with MSK conditions, and demonstrating professional progression, wider service development, with application of critical evidence, clinical guidelines and patient preference to manage complex MSK conditions. Those will be addressed within the portfolio element. Learning outcome 3 will be within the part A task, and learning outcome 4 will be within the part B aspect. But again, I'll come on to that. Throughout your learning and teaching time with us here at SHU, there will be aspects of learning including tutor-directed learning, face-to-face learning and peer-supported learning throughout. So we will ask you to go away and do pre-reading. We might ask you to do some practical skills sessions. We will have directed learning. There might be some screencasts involved. There might be some elements of utilising your clinical experience and clinical background to be able to feed in to your time here, and that will just broaden and deepen your knowledge and allow you to be able to meet the KSA and the framework much more robustly. Here you'll find a copy of the timetable for the module. You will find that the timetable is available on the Blackboard site, but do keep an eye on the announcement section and your emails so that you are up to date with any changes or last minute changes that might occur. So your tutor-directed learning, some tasks will be done prior to a teaching block, and these will be made available to you within the folders. They will prepare you for the face-to-face teaching. Some tasks will underpin the entire module, so should be completed as you go, and they'll feed into different aspects of the teaching. We will assume that these tasks have been completed. These tasks and completion of these tasks you might want to be used within your portfolio or within evidence-based practice for your completion of the roadmap itself with your work-based mentor. Some of the tasks will be completed after the block, and these tasks will help you to transfer your knowledge into practice. And completion of all the tasks will allow you to successfully complete the assessment process at the end of the module, and we'll feed into this. And we will have different aspects of assessment as we go along, just to try and help you towards the assessment process and the summative assessment process. You should allow approximately 15 hours per week for these tasks to get you to where you need to be. So from the assessment point of view, during the course of the module, we'll complete a range of tasks which are designed to prepare you for your summative assessment. The summative itself will consist of two aspects. So you'll have your OSCE, which will be the week commencing the 13th of December. We will confirm exact times close to that time. We'll make sure you've got enough time to be able to block out clinical space for yourself in your diary. The second task will be a 3,500 word assignment, which will be further split into two parts. So part A will be a 2,500 word complex case study, and Part B, 1,000-word critical reflection. I'm just going to change that. Let's say 1,000-word critical reflection. The deadline for which will be the 17th of December 2021, and more detail of this, and including the assignment brief, will all be available on the assessment section of the Blackboard site for you to have a look at in more detail. Other things you might like to know: the timetable for the module can be found on the Blackboard site under timetable. All your teaching materials will be available under learning materials. There's loads and loads of support available through the library in terms of critical writing and critical reflective skills, and also thinking about library search. So it depends where you are in your journey as to how much support you'll need from the library to be able to find appropriate resources and literature to underpin your knowledge. But do get in contact with the library and go through some of their resources to help you out. So we expect around 15 hours per week to tutor-directed tasks. Make sure you prepare for your tasks and your teaching with the tasks given to you. Make sure you take part enthusiastically and positively. Respect one another's opinions. Maintain patient confidentiality at all times. Work hard and enjoy your studies. And we'll ask you to complete a module evaluation at the end of the module so that we can continue to develop this module and keep it current and up to date for you all. Throughout the module, we expect you to keep a portfolio of your progress. This can include any number of the items listed there. This will be done in conjunction with your mentor, your placement mentor, who will be your work-based sort of clinical mentor that you will have to help you to achieve your goals within this module. So now just have a look on the using this site tab on the module homepage for a step-by-step guide to each aspect of the Blackboard site, or take a look at the introduction to the Blackboard site screencast on the module documents homepage. Familiarise yourself with the Blackboard site. This assignment brief and the module descriptor are particularly important. Any problems, get in contact with myself, or as you'll see on the staff details site, there's details for Shona McLean. I am away for the first part of this module, so Shona McLean will be taking over as module lead.